Thank you, Cindy, and welcome all to this webinar. And today's session is titled Cultural Considerations for Addressing Suicide Ideation, an Attempt in Indigenous and Hispanic and Latino Youth. My name is Angel Casillas Carmona, and I am the project manager for the National Hispanic and Latino Mental Health Technology Transfer Center. For me, it's a great pleasure to be with all of you today and be hosting this excellent webinar that is provided to you by one of our longtime collaborators, Dr. Rocky Romero, who will be giving us today's presentation and walking us through these excellent slides. So without any further ado, Rocky, thank you for being here.
Thank you, Angel and Cindy, and of course, thank you to the Mental Health Technology and Transfer Center for allowing me to speak as a representative of the center, but more importantly, bringing a very important topic to you all in today's subject. So I want to make sure that we definitely have enough time. We have about 2.5 hours of time together. We probably will give you guys just a short break in between, just kind of depending how things are going. But I'm happy to be with you again. I'm Rocky Romero. I'm coming to you from Albuquerque, New Mexico. As many of you know, the centers are located, or the center is located out in Puerto Rico. So with that said, we always want to make sure that we start by reinforcing appropriate language use that affirms a respectful and recovery-oriented language approach, and that comes from strength-based, with offering hope and inspiration, that is inclusive and accepting of diverse cultures, genders, perspectives, and experiences, with healing at the center of this for Latino and Hispanic families and communities. We definitely want to invite people to be a part of their journey in the sense of healing, and we definitely look at it from a person first, not necessarily trying to establish a continuation of labels that have been placed on Latino communities and Hispanic communities for several decades now. Definitely taking a non-judgmental, avoiding assumptions, while taking a respectful stance is where the MHTTC really is coming to you from. The co-sponsors of our presentation today are community partners of South Florida. So I really am excited to touch base with folks from the East Coast of the United States, and I'm very happy to be back with the Phyllis and Harvey Sandler School of Social Work, and having presented for them before as well. So we're very happy and appreciative of those relationships. You know, I think one thing we want to make sure is that this presentation is under the cooperative agreement, as was said, by SAMHSA, and through SAMHSA, this presentation is directly available for public use. We just ask that you get in touch with the National Hispanic and Latino MHTTC, where there are recordings of this presentation, and we do offer, of course, follow-up technical assistance, as well as more direct trainings with your community and/or agency as you see needed. So I declare that there are no conflicts of interest that I can see within this presentation. I do come from a place of really making sure that we want to encourage you to please go to the evaluation afterwards. This is what does drive funding and gives us the opportunity to bring back these trainings to you all free of charge, that offer not only training nationally, but also individually within your region, and potentially can offer additional technical assistance with the different topics that we present on. Our Survey Monkey link is here at the bottom there, and of course you can access that also through your QR scan in your phone as well. Alrighty, so I'm gonna go ahead and get into what we're here for today. And like I mentioned, and Angel mentioned, I've been a trainer with the Mental Health Technology Transfer Center for the last 11 years. I was a part of the inception of this program as far as the Mental Health Technology Transfer Center, and was a part of the Universidad Centro del Caribe Addiction Technology Transfer Center prior to them getting funded under the mental health side of things. So very happy to have a long-term relationship with the centers, and I can't say enough about the cadre of practitioners and professionals, experts, people in the community that we have that incorporate their thoughts and ideas into some of these trainings as well. and actually develop them. So our objectives for our time together today, and I'm glad we have a little bit more time than my last time talking about suicide specific issues within the Latino and Hispanic communities, specifically around Latino youth and young people. So what we want to help to do is identify some of the trends relative to mental health disorders, but including more specifically suicidal thoughts and behaviors. Looking at discussing also culture specific risk and protective factors associated with mental health. And then lastly, identify ways in which language use can improve mental health among Latino youth. And I'm hopeful that I can kind of bring that perspective to you as well. So we start off kind of with a look at disparities. And I know I may be preaching to the choir in some of this, but I think it's important that we look at this from disparities relative to thoughts and feelings that are persistent around sadness and hopelessness. We see that a lot, and one piece of research or data that is really relevant that many states participate in. So you may want to check with Florida and in your region and see if your high schools or junior highs participate in the risk and resiliency studies. That is something that has been happening, I want to say, for about 10 years now, if my memory serves me correctly. But it adds to this body of language here where we look at disparities. We know that students experience, when we're looking at Hispanic students specifically, experience 33% more persistent feelings of sadness and or hopelessness. Are more likely to have initiated alcohol use or cigarette use in the past year, and then are half as likely as white children to use stimulants to treat disorders such as attention deficit hyperactivity disorder. So it kind of brings into perspective a very important aspect of our trainings always is the cultural relevance of mental health disorders and or in this case suicidal ideation, and how we can present this information to you so that you can be more informed in your approaches, your intake, your assessments, and your overall relationship building with Hispanic and Latino students and young people. This research here from this slide comes from the Center for Disease Control, and we definitely look at it from NAMI's perspective as well, where we look at Latino communities showing similar susceptibility to mental illness as the general population. Unfortunately, the disparities that we see in communities relative to access to education, access to good jobs, access to good health care or culturally appropriate services, all of those things impact more directly the impact of community and society on mental health. And we have to understand that when we look at it from the perspective of a systems approach to this work as well. With this inequality, it definitely puts Latino and Hispanic communities and youth more specifically at higher risk for severe and persistent mental health conditions. We also have to look at, and we didn't include it in this presentation, but I usually do note it at least or reference the adverse childhood experiences that we have young people experiencing now. And we can't say enough about unaccompanied migrant children that are we're experiencing at significant rates with some of the historic population and immigration law that has failed our communities. And let's just be honest about that. And by me saying that we're failing our communities, Latino and Hispanic communities and kids with potentially over 4,000 kids in United States custody without knowing any idea of who their parents may be at this point, we have failed our kids and we have failed our community. Whether we believe in asylum, we believe in appropriate immigration law, whatever we believe in, that is to me a moot point at this time, given that those kids are in a position where we're adversely affecting their future. We're putting them in situations where potentially some of the research, when you look at adverse childhood experiences, put Latino population that experience 3 to 4 or more adverse childhood experiences. So when you talk about their immigration journey, when you talk about separation from their families, when you talk about the abuse or neglect that they may experience along the way of their journey immigration-wise, that right there is 3 to 4 adverse childhood experiences within their first 12 to 15 years of existence. With that said, that increases the likelihood of suicidal ideation by almost 12 times the national average for other communities even of color, but also of the general population. So we have to really take a hard look at the long-term effects that these policies or lack thereof are doing to our young people. And when I say that, by no means do I want to create in this training an adverse or a divisive sort of relationship with other populations, but I think we have to call reality what it is in the sense of looking at this through the disparities and how different races are treated and given access to services compared to others. And if we don't encourage that dissection or critical reflection, we may be missing the point significantly. Common mental health disorders among Latinos. So in general, we see that some of the common mental health disorders are no different than those that the general population may experience, and this is going back to NAMI 2019. But more specifically for Latinos, some generalized anxiety disorder, and we're going to get more into the areas of idioms of distress and so forth on the second part of this training this morning or this afternoon for some of you on the East Coast. Depressive disorders, post-traumatic stress disorders, substance use disorders. And when we look at this theoretically, we can definitely look at it from adverse childhood experiences, learned behavior, and obviously post-traumatic stress as it's listed here as one of the predominant mental health disorders that young people may be experiencing, or at least like we talked about, not wanting to diagnose or label young people or pathologize young Latinos, maybe experience generalized anxiety disorder and or general experiences of acculturation distress, and we'll definitely get into some of that today as well. So the depressive symptoms that we want to highlight in terms of, again, symptomatology, unusual sadness or irritability with, again, not otherwise described or identified from any other circumstances, a loss of interest in activities they once enjoyed, reducing feelings of anticipation, changes in weight or eating habits, shifts in sleep patterns, sluggishness, harsh self-assessment, I'm ugly, I'm no good, I'll never make friends, feelings of worthlessness and hopelessness, or thoughts or attempts at suicide. And this data referenced here comes from the Child Mind Institute. But what we have to also think about and consider in your own work, those of you that are working directly with clients, whether it's in the school systems, community-based organizations, or you're working more in directly with family work, adults, but obviously adults may have children that are experiencing situations as well. We also have to look, and this presentation doesn't do that so much, but I think it's worthwhile noting that we have to look at the history, even given the last 4 years prior to new administration taking over in this country, the rhetoric and discourse that was put out about immigration and about immigrants, basically labeling immigrants and painting them in this picture of criminal, of different, of other, of illegal. Where we talk about Bell Hooks and her work in othering of people, othering of groups of color that continues to further marginalize them in our communities. We have to think about all of those things inclusive of some of these symptomatologies that we talked about. So I think it's important to infuse some of that as we're looking at this, is how is the rhetoric, how is social media, how is language and discourse impacting and creating depression, creating anxiety. So what are our clients consuming in terms of information, in terms of social media and data that we have to understand that is coming to them in different places, in different waves. Now we see this also taking shape with our other brothers and sisters from Japanese, Chinese, Filipino descent, where they're now getting attacked in public based on physical characteristics, physical features. When we look at critical race theory and the way that our government creates groups of people to think of each other as different and physical characteristics are some of those traits where people that have been born in the United States their entire life have never lived in a country other than the United States, yet have features that exhibit a tendency to resemble Filipino or Japanese or any of those other country descent, puts them in a place of risk. And we have to also see that same experience to a degree when we're talking about Hispanic and Latino communities, given this rhetoric around immigration. And, that somewhat has changed given our change in leadership in the United States. However, we also know that some of that rhetoric still stays true, especially when we're hearing rhetoric talking about immigration, illegal immigrants, all of those things, when many of these individuals are seeking asylum from violence in their countries. So we really have to re-examine of how we portray these individuals and how we label them and categorize them, in honestly putting them into a conflictual position with other dominant groups in our communities, and more precisely, white or Anglo groups in our communities, it seems, in most of the research that we look at. Symptoms of anxiety may include trouble sleeping, again, lack of eating, maybe some symptomatology that's more physiological in terms of stomach aches and or other physical symptoms, exhibiting clingy behavior around parents or caregivers, especially when young people are at the adolescent age or youth age, where they typically at that age are more wanting to push parents away, right, and not really be seen with them, or I saw a friend of mine posting a picture today about the first day of school. New Mexico has now decided to put kids back in school with a few months left in the school year, and this junior high kiddo didn't want to have a picture taken by his dad. So typically we have to see what are normal behaviors from a young person, and if that is not being displayed, so we see teenagers that are more clingy and always want to be at home, never want to go out. Those are signs that we may have to look at, that maybe they have social anxiety, maybe they're having trauma within schools or within their social experience that we have to really identify and highlight. They may be experiencing trouble focusing on class and fidgety. And I tell you now, those of you that are now experiencing also in your communities hybrid reintegration of schools, we now have to look at what are the COVID symptoms that young people are going to experience as they now get back into schools. And I think it's important that we just highlight some of that throughout today as well. And that may be more anxiety now with going back to school. Maybe at home, the learning that they had to do through social media and through web-based learning, internet learning, computer-based learning, maybe gave them some comfort because at least they were in their home. Maybe they still experience anxiety, but people and young people of Latino and Hispanic descent, as they now get ready to go back to school, may be feeling a little bit anxious about that, given all of the rhetoric we've seen around our country, especially in the United States, around immigration, illegal immigration, mass, of course, what the media talks about, mass populations of people coming into our borders, which again, we have to understand is always kind of a hysteria that's built within the United States. That's always a way to divide and conquer, if you will. So a way to continue those legacies of colonization that we've seen historically in our communities. We definitely have to take a closer look at the difference between Latina and Latino. Even when we're looking at Latinx population or the Latinx community now, understanding that Latinx is a reclaiming of the Latino, Latina, so that we're not putting young people or our youth in these dichotomies, in gender binaries, but giving them more broad ways of explaining or describing themselves as Latino youth. And that's kind of what that movement has evolved over the last several years. So like I was mentioning, the 2017 Risk and Resiliency Behavior Surveillance work, and I believe they just released, or they're going to soon, I believe it was 2020, but I may be wrong, 2021, a new data set that they'll be putting out that really looks at some of this risk behavior for our adolescents. And specifically in New Mexico, it really gives us a solid view of what young people are experiencing. So Some of the data points to Latinas having higher propensity when it looks at 1 out of 10 Latinas attempted suicide in the past year. 2 out of 10 made a suicide plan. Half said they felt hopeless. So we know that there's correlation between feelings of hopelessness and despair, sadness with suicidality, especially in the Latino population. And we have to understand that that may be coming from a number of different variables, right? One may be their journey, their experience with acculturation, immigration. Another may be their acculturation and assimilation into United States culture, whatever that looks like, school, community, familial changes, right, around cultural values, so on and so forth. So we have to look at each one of those variables that impact a child's experience as they're coming into the United States. And or I've seen this also with kiddos that were born in this country and have never lived or left this country or the state of New Mexico, who also get categorized as other or as where are you from? Right? You can't be from here. You look different. Your eyes are different. The color of your skin is different. Where are you from? Right? And when people get asked those questions, those are those microaggression around racism that we have to be very cautious of. If you're showing genuine concern or wanting to learn where that individual is from, I think there's appropriate and tactful ways to do so. And we as practitioners and policymakers, administrators definitely have to know what that looks like and be able to teach that and replicate that within our community-based trainings, agency training, staff trainings, etc. So to further dig down a little bit deeper here and drilling into some of the warning signs of suicide: isolation from friends and family, problems eating or sleeping, mood swings, reckless behavior, dropping grades or truancy. Definitely we see that a lot. Increased use of alcohol or school or drugs. One big thing that I want to talk about here, where we talk about school systems, and obviously our training that we have for school-based mental health talks about that a lot, and this is a big piece of it, where we also have to do some critical self-reflection as individuals that are employees of a system, i.e. school, i.e. community-based agency, that may be perpetuating racism, that may be saying things in a way within the school like illegal immigrant or those people or they, rather than using descriptors of us as people, as a community, as a school community. Those sort of subtle changes in our language use can really help kiddos feel more inclusive. Now, that's at the surface level, right? We have to do things much deeper than just talking a good talk to make young people feel safer in our schools. And one of the things that always sticks out to me that I always felt as a, not only as a school-based school social worker and those experiences I had, but now as a trainer, I really feel it's important for me to always remember that systems can very much be perpetuating racism within a system. And as individual members of that system or the staff that kind of holds that institution together, we have to make decisions. And if you're coming from the world of social work like I am, I have ethical considerations to think about when I'm talking about experiences of seeing young people discriminated against or talked about in ways that is racist or derogatory or continues this dialogue of separation, us against them dichotomy. I really think that in our neck of the woods in New Mexico, a lot of young people in schools that were surveyed with the Youth Risk and Resiliency Studies really pointed to not feeling safe in schools. And when we look at the dropout rate of our young Latino population, what is that saying about our school system? Are we saying that every single Latino, because they're Latino, because they come from different family, different cultural values, whatever it may look like, that it's their fault that they're dropping out of school? Or from a systems theory approach, restorative justice approach, do we look at the school to prison pipeline? Do we look at the way systems continue to perpetuate racism and discrimination? Or do we continue to ignore that and be complicit to that? And as individuals that are licensed, many of us, we have an obligation ethically to disrupt racism, to stand up for those that can't stand up for themselves or don't have a voice, right? We're the voice at that table for them. And I'm not saying to speak for groups of color or for Latino communities, but get with coalitions, get with other community organizing groups that have a way for you to be incorporated into that platform. Because I'm telling you, those of you that are coming from the dominant group or feel as though you have some privilege or you have some way of impacting systems, we need you at the table in order to advocate for Latinos and Hispanics as well. We're going to continue to do it for ourselves, but we need allies, and a lot of times that can be with other people that have these circles of influence that we may not have in our periphery. So we definitely want to ask for your help in that as well. So other factors around suicide signs is talking about being a burden to others or not belonging, talking about suicide or wanting to die. Again, illustration, writing or drawing, journaling, maybe giving away possessions, as it says above as well. Those are some of the things that we see young people, and not just when I talk about adolescents and youth, I should clarify that. To me, that also means young Latinos that are 18 to 21, 18 to 25. And we see here, as the research talks about, 20 to 24 is also a very significant age group that we have to consider around suicidality, right? That's where we see these definitely more significant, oops, I'm sorry about that, significant jumps, right in this ages here, around age groups where we see 15 to 19, 20 to 24, even mid-age as we look at um, um, females as well. So we have to take into consideration age and not just lump Latino youth within kind of that 12 to 18 year of age. We have to look a little bit beyond that as well as we see the impact that it has to that generation of young people also. Suicide trends in Hispanic by age group. Of course, when you break it down by gender, males and females, and we're really doing our young people in the Hispanic population a disservice because we're not yet counting those that come from the LGBTQ populations that may not choose a male or female label for themselves. They may be transgender, they may be experiencing fluidity in terms of their gender experience. So we have to understand that, and we have to just be cautious in that. But for the data that we're reviewing here, we definitely see that females, typically in terms of suffocation, hanging, and otherwise, 57% is their mode, which is again considered a less violent mode if you can consider that. I mean, suffocating yourself or hanging yourself is definitely, to me, violent in that sense. 15% by poisoning. So this number may be more significant if we were truly to understand how many young people take their life by suicide through the use of drugs and or alcohol, right? We may not know that typically. 18% by firearms, and then we have 10% by other means. Here we also see the significance or the more intended, where we say that typically males with firearms have more intent to take their own life by suicidality. And those are things that we definitely have to think about when we're talking about looking at plans and accessibility, and when we're doing intakes and questioning young people, asking them what they have in terms of access to firearms. I know in Latino communities, it's not very hard to get firearms on the street, but I will tell you also that there's a cultural aspect to hunters and people that do hunting as a part of their cultural belief system, and also as ways to feed their family throughout the winter months as well. That a lot of young Latino, I would say in our region, New Mexico, Texas, this kind of Southwest region, definitely have access to firearms. So understanding your regional kind of setting is definitely an important aspect of that. Making sure that families have gun safes, they have trigger locks or ways that they can lock up those firearms is definitely key when you're talking about assessing risk within the home as well, and then a further assessing plan and intent as we talk about that moving forward. So here, trends in suicidal ideation plans and attempts. We definitely see female suicidal ideation and plans that are showing kind of higher numbers. When we look at the male, definitely we see, like I said, that intent, whereas females may be um, seeking help in many ways, maybe asking for help. Maybe these ideation and plans are their attempts at asking for help before they actually physically seek to harm themselves. Some of the research that I want to highlight here as well also points to, which I think is important data. So if you do, and it's really coming out of the National Suicide Office, where we look at even young people's participation on their social media profiles prior to a suicide attempt and or trying to take their life by suicide, by the means of suicide. What that means is that you'll see young people start to pull off of social media at times. 24 to 48 hours is kind of that general window, and it may go further, into 3 or 4 days, where you start to see young people pulling off of or not being as active in their social media platforms. So we're talking, Twitter, we're talking Facebook for some cases, we're talking Instagram and other social media platforms. So if you're a counselor or school social worker that also looks at social media, and you're working with clients and you all of a sudden start to see them pulling away from social media interactions, you may want to reach out, you may want to text them, you may want to get on the phone and call and see what's going on with them, to get a better picture and better idea. It's always better to ask and err on the side of caution, right? Safety is paramount always when we're talking about suicidality. Just to give you guys a quick glimpse of kind of the screenshot, if you will, of Florida. 3,426 suicide, which was the second leading cause of death for people ages 10 to 34. So we see that what I would call late adolescence, which if you look at brain development, that's a key aspect to brain development, right? We see that brain development is even lasting into mid to late 20s. If that's the case, then we know that the prefrontal cortex may still be developing into that age. And with that said, young people may not see the long-term consequences of their suicide attempts and or acts of carrying out suicide, right? That they are permanent. That many times you can't come back from that. And if you do, many young people suffer from traumatic brain injuries or other ailments that have impacted them because of their suicide attempts. According to this research also, it's the fourth leading cause among people ages 35 to 54. So we kind of look at that age group. And then the fifth is the 45 to 54. So that mid-age, if you will, middle age group is also of high prevalence. Some of the highest rates are among, of course, Alaskan Native, American Indian, and non-Hispanic white populations, veterans, obviously with high susceptibility. Definitely we see this in our neck of the woods also, people who live in rural areas with very low accessibility to services. And then definitely we see this also workers in certain industries and occupations. Obviously we see a lot within police and law enforcement, and that's a continuing trend. Young people also who are experiencing just sexuality changes and awareness for themselves. There's a study that's called Injustices at Every Turn. And if I can here, I'll throw that up in our little chat here so you guys can see that. But it's called Injustices at Every Turn, and it's the largest study that's been done on transgender LGBTQ populations. And it just talks about, with all of these disparities that I highlighted specific to Latino youth and Latinx populations, when we look at that study, it shows 3 or 4 or 5 times more likelihood for young people and young adults to experience suicidality if they come from the LGBTQ plus communities. So we have to really look at this and start to kind of bear down, if you will, or drill down more when we look at these kind of screenshots of what suicide looks like in our community, so that we can reach out to those community members maybe that we haven't in the past. Suicide vulnerability. We definitely want to see this and make sure that we're talking about it as well. And I'm just quickly going to look at, all right, so I just want to make sure that we are looking at our time. I also want to make sure that I give you guys at least about 30 minutes at the end to send any questions to our moderator and to let us know if we can clarify for anything for you all as we move forward. So suicide vulnerability. I think I've kind of put this into a contextual kind of and data framework for you as we move forward, where we look at the vulnerability of different ethnicities. So cultural characteristics can definitely add to susceptibility and likelihood and vulnerability of these groups. So we're looking at Latino and American Indians and Alaskan Natives. For Latinos, fatalism or manifest destiny is another way that people talk about this, where fatalism coupled with negative attitude sometimes creates a downward kind of spiral for Latinas and Latinos, and it may contribute to their increased symptoms of hopelessness, of sadness. It almost is in a way them saying, "This is my destiny. This is what my life is going to be, and this is just the way it has to become and the way it is." And we definitely can encourage them and give them different frames of references to think about when we're working with them in different therapeutic settings, and as well as working with young people in prevention strategies. When we look at American Indians and Alaskan Natives, and it's really interesting because now we're almost seeing, some of you may be familiar with the Native Americans and indigenous populations' experiences with the Long Walk. The Navajo have documented this in their own history pretty significantly. So if you ever look up any Navajo, the Long Walk is a very good documentary of historical trauma that has been perpetuated against Navajos and the separation of young people through boarding schools and through just violence and the colonization through Hispanic colonization that occurred. We see this intergenerational trauma, and many people don't understand it, that 400, 500 years have passed, and certain cultural groups of indigenous and American Indian groups, as well as Latinos in different communities, are still experiencing post-traumatic effects or symptoms given the importance of oral history in these cultures. Latino and American Indian indigenous communities have a very strong, and Alaska Natives have a very strong oral history component to their cultural value base. And a lot of times that is what continues the storytelling and passing along of some of this traumatic histories. And we definitely have to consider that when we're working with people that report to you, or doing some research around where they come from in their region, have these questions and have these concerns, for us to really be considerate of that as well. So looking at the work of Chu, Goldblum, Floyd, and Bunger, we see these four areas that are really important, these four factors that really encompass, if you will, kind of taking into consideration suicide risk that's based in cultural appropriateness. So cultural sanctions, and we're going to talk about each of these: minority stress, social discord, and then idioms of distress. Now, we have to understand that each one of these kind of breaks down into different pieces that we want you to be aware of. So the cultural theory or model of suicide that we look at, based on the researchers noted, there's three key concepts. One is look for different signs of suicide. So cultural idioms of distress, right? Where someone may be giving you different cultural symptoms that they experience, and it may not look exactly like the general population around some of these symptoms. It may be outbursts of anxiety, outbursts of just screaming out loudly, and we'll talk about some of those kind of more traditional ways of addressing some of those cultural idioms of distress here in just a little bit. Number two, suicide may be precipitated by different stressors: minority stress, social discord. Sometimes we've also seen where the Virgen de Guadalupe in certain families plays a role within the way that young Latinas are supposed to act and the way that they're supposed to behave. And when they don't fit that mold or that model, they tend to be outside of the cultural norm, therefore creating minority stress, therefore creating these kind of dichotomies or biculturalism, if you will, of their United States and a acculturation versus their home country and what their family may still believe very, very strongly in. And that creating, again, some social discord. Number three, look for the meaning of things. So cultural sanctions. Sometimes it's very interesting. You'll hear young people talk about not only the way that their family sanctions in terms of behaviors and consequences for bad behaviors within a family structure, but you also hear young people talking about how they sanction themselves based on their cultural beliefs as well. And I'll highlight some of those as we move through the next several slides. But cultural sanctions, definitely something that we want to think about. So now breaking down these concepts of distress when we look through it through the cultural lens is definitely something I want you all to take forward with you and really think about as we move into kind of the intervention and treatment side of our training for today, is really looking at cultural syndrome. So groups of symptoms that co-occur among individuals in specific cultural groups, communities, and contexts. A very prominent and I'd say common reference or syndrome is ataque de nervios, right, or attack of the nerves. Some people would call this kind of a nervous breakdown in some cases, where somebody just has anxiety to the point where they are overwhelmed. They can't function in their normal functioning and duties or roles, whatever that may look like for them, and they just have an overwhelming sense of doom and or perceived hopelessness for the future. Cultural idioms of distress looks more at the ways that those symptoms are expressed collectively and individually. And collectively, we mean even familial wise within the family and or community wide. And this very much looks like when we talk about immigration in our country today, this creates pockets within our community of people who become very anxious and nervous about engaging in social systems or in governmental systems. And I'm sorry to say, folks, that even if you're just a government-based agency, unless you really have done your work to separate yourself from government and the man, right, or government entities, most Latinos and Latinas see folks that are associated with that sort of professional world as sometimes a threat, unless we've done our work and we really created a safe experience in a safe environment. Right up until year before last, we still had schools that were allowing the federal government to go in and take young Latinos that were perceived to be illegal immigrants or criminal out of schools and arrest them and put them in prisoner of war camps, as I like to call them, right? So we've seen how these cultural idioms of distress can be very much within communities and several community members experiencing it on multiple levels. Cultural explanations, definitely the ways that we see labels, attributions, or features of an explanatory model that indicate a culturally recognized meaning or ideology. Symptoms, illness, or distress. Susto or fright, mal de ojo, those are two that are pretty common within the Latinx communities, where even if you go to South America or countries as part of that triangle, there's some very similar beliefs that are relatable to New Mexico or to this region that we have to think about and consider in that. And when we talk about susto or mal de ojo, susto I think is one that a lot of people are experiencing now with their immigration journey and adverse childhood experiences that we really see taking shape. When we look at mal de ojo, that's one that usually has to do with envidia or jealousy, or when a person, in a sense, in the Latin community, really takes over a child, usually over a child, really takes kind of a possession in the sense that they're very fond of this young person and kind of is a little too kind of I hate to say it, but a little too kind of over this young person in the sense that many of the cultural belief systems around Mar de Ojo have to do with this adult person many times kind of taking or impacting the soul of the young child. And I know a lot about this because my mother experienced this when she was about 2 or 3 years old, and they didn't know what was going on with her. They went to all these different doctors who couldn't identify or pinpoint what exactly she was experiencing until they experienced and went to a curandera or a healer, what we call in this part of the country, that really helped my grandmother and my grandfather at that time. Helped my mom to they did the egg ceremony it's another ceremony. I won't get into all the details here, but it's a ceremony that they perform to try to extract. It's almost like fever type symptoms, almost colicky, if you want to explain it in Western medicine terms, where there's no resolving kind of the distress that the child is in. They're constantly crying, constantly high fevers is a part of it, which, as you know, with young children can be very, very dangerous medically. So those are just some examples. Now, with susto or fright, like I mentioned, I think a lot of people experiencing the immigration journey and being incarcerated in prisoner of war camps for simply being an asylum seeker and from another country with different physical characteristics, brown skin, brown eyes, Spanish language, or otherwise, they get put in prisoner of war camps and treated as other, treated as different. So we definitely have to understand that many of these young people may be experiencing susto or fright, and I say many, but I would venture to say all of them are to some degree, without sounding too much of an alarmist or extremist. I would say all of those kiddos are experiencing fright to some degree. So getting a little deeper into this, and I kind of covered these, so I won't spend a lot of time, but these are just some slides that you guys can have and take with you to kind of examine these a little bit more. What's really important about this is now these syndromes are also being referenced in APA documents, and they're starting to be addressed also within when we look at the DSM as well. And the cultural formulation interview is one that you guys can definitely utilize and adapt to your setting to really start to get at some of these cultural syndromes that we're introducing. So ataque de nervios, characterized by symptoms of intense emotional upset, anxiety, screaming, shouting, crying, trembling, may include verbal and physical aggression. So as you, as a non-Latino or someone that doesn't come from that cultural experience, maybe seeing this, it may present to you as someone that is presenting very, very almost bipolar, right? Almost in a way that is kind of the manic and the ups and downs of what that disorder may look like. But we have to be cautious that we don't slap a label on this or a diagnosis before truly getting to, maybe they're really experiencing a cultural syndrome that is more anxiety than a significant mental health disorder that we need to diagnose. So we can always rule those things out, but let's be cautious not to diagnose Latinos too soon with these mental health disorders that may further perpetuate disparities in our communities. Dissociative experiences, so seizure-like fainting episodes, these may include suicidal gestures, which are prominent of attacks or ataques, but absent in others. Mostly occur as a direct exposure to a stressful event relating to family. So we also see this when families are on the journey of immigration and they lose contact with other family members that may already be in the United States or in any other country that they've immigrated to, and there may be the separation experience that we have to think about. The idioms or nervios that we look at that play more of a physiological prominence or present as physiological many times, again, in terms of nervios with children and adolescents, can be described as these young people present in your office, in the nurse's office, in your community-based organization as having headaches, irritability, stomach disturbances, sleep difficulties, maybe butterflies in the stomach or uneasy stomach, difficulty sleeping, nervousness, easy tearfulness, or easy to cry or be tearful when just being asked, how are you doing? What's going on with you? Where is your family? How are they doing on their journey? So on and so forth. And we definitely have to assess and really take into consideration the immigration and acculturation process that this young person or family may be experiencing as they present to you. Susto or fright, again, we talked about this frightening event that causes the soul to leave the body and results in unhappiness and sickness. Many times through doing Olympias or cleansings, we can see that many times when people believe culturally in more traditional approaches to addressing mental health or the symptoms, they may not even consider mental health. They may describe more as fright or anxiety or feeling, discomfort in the stomach. May give you more appropriate diagnosis opportunities as you look at these things in your practice. The syndrome again may occur with somatic symptoms as well. It's more prevalent among Latinos living in the U.S. that are from Mexico, Central America, and South America. Again, looking kind of at the triangle of immigration that we talk about. Mal de ojo, same kind of thing that I explained earlier. Making eye contact with someone is received through the eyes, intended recipient. Frequently, it's when someone, an adult usually, covets the victim child, and it's kind of passed through. Again, and you may think of this as someone that's not from the Latino culture. When you're reading this as something that's doesn't really make sense to you or doesn't really kind of connect with your understanding and knowing of mental health and or other cultural symptomatology. So heats the blood of the victim, causing multiple gastrointestinal problems. Like I mentioned, my mom had this, and it's something that we've experienced as a family. So I think it's worthwhile kind of encouraging you to examine that, to check into it, to ask about that with clients that you're seeing that you may not be able to identify any other specific disorder that resembles their symptomatology. Minority stress, again, cultural minorities experiencing these in different ways. We know one prime example of minority stress is if you ever get a chance to look at Race, the Power of an Illusion. It's a 3-part series, a video series that looks at how people that have immigrated from other countries with relatively good health, when they get to the United States based on their immigration, acculturation, and their experience with racism and discrimination, a lot of times creates all these different stressors, and a lot of times can point to medical issues that either were exacerbated or actually manifested as a part of their experience immigrating into our country. And when we look at this, and I hate to say this, folks, and I'm the first to acknowledge I'm a very privileged young person, or I think young person, maybe not so young anymore, but person from the United States that believes that we are one of the best countries in the world. At the same time, though, we have a very significant issue with racism and discrimination in this country. And if we're not open enough and keeping an open mind enough to think about that and to identify those factors and facts that there is within the data that we look at, then we're basically creating complicity. We're complicit to the issues, and we may be perpetuating those. So understanding that, I think recognizing my privilege and position within the United States as someone that can speak their own mind and speak up about these things, I think we would really be remiss as licensed professionals if we didn't speak up for minorities when they are experiencing these stressors in our communities, in our schools, and in our community-based agencies. So it leads us to this kind of more deeper dive, if you will, into acculturation stress, and then looking at acculturation gaps. Aspects of intergenerational conflicts and kind of what that looks like. So when we look at acculturation, The role of acculturation typically can be in some ways considered a protective, but it may also be a risk factor when we look at it through the mental health kind of lens. I think as practitioners, we have to think about this from multiple intersections, especially when we look at it through the life of a young Latino or Latina or Latinx person that is acculturating to this country. There's a lot of integrating, there's a lot of challenging, there's a lot of assimilation, maybe separation from their family who is very traditional in cultural values and beliefs, yet they're trying to acculturate into American society. We see a lot of times that knowledge-wise, in terms of social media, technology, um, is really in hyper speed for the young person compared to their parents or grandparents or aunts or uncles, whoever they, are staying with or see as their um, their caregiver or person who is overseeing their growing up in the United States. There's a lot of trauma that goes into this, folks, and we have to see that. Those of you that are working in schools, I'm sure, can talk about that and see that when it comes to even just brand names of shoes, of clothes, the way people dress, the way young people cut their hair or not. All of these factors on top of a young person that's coming from immigrating from their home country and acculturating is experiencing all of these stressors on top of the normal everyday stressors of adolescence. So we have to think about that. And acculturation can sometimes put familial stress because the family thinks that the young person is kind of shedding or not respecting their cultural values from their home country that they may practice at home still. Yet when the young person goes into the community, they may be trying to be more acculturated to United States values, if you will. Marginalization happens through policies, institutions, and daily interactions. I think I've highlighted that throughout this morning's discussion. And that may play out, like I said, in racism, oppression, anti-immigration laws or policies. Racism definitely can lead to ethnoracial trauma when we talk about the immigrant, Hispanic, and Latino communities. And we have to understand that when we talk about the clients and the families that we serve in our institutions, we have to be, I think, realists in the sense of what are these young people and these families dealing with if they're not in the United States. Now, if they were in the United States and they're maybe second, third, fourth generation already here, or they are Latin or Hispanic and they are a person of color and have all those features, just know that they may be experiencing the same racism and oppression that someone that is immigrating to this country may be experiencing just based on facial characteristics and physical features, phenotypical features, right? So we have to understand that and know that that is still taking place within our communities and within the United States. Chu talks a lot about these cultural sanctions, which I think are important to understand. And this is where you as an individual provider, if you're working directly with young people, can really gain some value and understanding of their culture as you visit with them, as you develop their relationship, because some cultures really put a high prominence on shame and really guilt. And sometimes that comes from religious beliefs, but that can also be connected to religious, cultural, and spiritual beliefs that are all intertwined, and we have to just take that into consideration as well. So social discord, it means that the individual is playing out the mental health and or addiction that they're experiencing through social discord, which means thinking of suicide, maybe making suicide attempts, alienation, conflict, lack of integration. One other factor that we talk a lot about, which I highlight here, we don't necessarily pull it into the presentation, but we see a lot of young Latino males and even females that because of their immigration and familial experience, they tend to lean towards gang involvement and seeking that sort of Maslow's hierarchy of needs through gang involvement and through others who have maybe experienced similar discord in their social experience as well. So think about that when we're looking at gang-involved individuals from the Latino populations. And I'm very excited. We're just getting ready to wrap up in the next couple of months our Latino gang curriculum that focuses on Latino experience. But we come from a very different approach. Rather than suppression and racial profiling, we come from one of understanding disparities and understanding some of the risk factors that we're actually highlighting a little bit here today, but we go in much more depth with that as well. So those of you that may be interested in that sort of training down the road, please reach out, send us a message in your chat, in our chat here, if you're able to do that, and we'll reach back out to you guys and get you some information on that. We're hoping on unrolling that this summer and into the fall for schools that are going back into school next fall. We definitely see protective factors, and I think it's a good segue given what I just mentioned, gang involvement. Many times we see gang involvement from Latinos or any youth as a risk factor. But unfortunately, within our work and our review and our literature review and research, we also know that gang involvement can also serve as a protective factor, not only through the immigration experience, but also through if this individual that is gang involved or thinking of gang involvement comes from a family that doesn't have a lot of familial support or is kind of broken up given immigration, incarceration, other factors, we may know that this happens pretty quickly, where a young person may seek their own youth group that may be gang involved to get some of those love and compassion and some of those needs met. And they may be protective factors. So we've got to be cautious not to rip away those protective factors from a young person when that may be the one thing that's keeping them safe at this point in their community. So in the role of the family, and we're at 12:03 my time, 2:03 your time. So we're going to just go a few more minutes, and then I'm going to give you all an opportunity, just because it's a 3-hour training, just to kind of, we'll give you guys a 5 or 10 minute break just to get up and stretch. I really hope we don't lose anybody in between that time, but I want to make sure that we just give folks, I know sometimes, at least for me, screen fatigue is a real thing nowadays, right? Doing all of our interactions through Zoom. So one thing I want to highlight before we get to that point is looking at the role of the family in this work. So when you're working with young people who present to you that are experiencing some of these cultural idioms of distress, maybe in conflict with their own cultural values from their home country and their acculturation and United States customs and cultures that they're learning, what do we see as the role of the family? Well, we definitely see that we have to create opportunities for education and information through lowering some of this misinformation or stigma that Latino families have around mental health treatment and addiction treatment. So that's one thing that we can do as part of a education, public service announcements, prevention strategies in our communities. Send appropriate Latino messaging that is inclusive, that is not divisive in any way, that is not labeling people from these countries that have immigrated to the United States as illegal, as criminal, as other, as we mentioned earlier. Latino families will typically turn to community-based, so traditional healers, maybe even priests or less formal structures for help before they reach out to a mental health provider. And they may also, we have to be cautious because sometimes family members will share medications and or give advice to other family members based on their own experience. And we want to definitely make sure that we don't have families practicing that, because we know that individualized treatment should ethically be provided for that individual, and not, especially when we're talking pharmaceuticals, prescriptions, any other things of that nature, provided to other family members. We know also the cultural value of familismo, so family creates a very important basis and strategy for continuing care and developing a relationship, and should be at the forefront of our care with our Latino families. And I think when you start from that position, typically you'll have really good luck in terms of your success and outcomes. When we look at the role, and this kind of integrates back with some of the cultural idioms of distress, but the mental health protective factors when we look at religion and spirituality definitely have to be thought about and considered. And it may be that the family is not connected to religion or spirituality. I would venture to say that, man, and I would probably put it pretty high at 80, 85 to 90% of our families that come from Latino or Hispanic communities typically have some connection spiritually or religious wise. At least it's been my experience. And okay, you may have that 10 or 15% that just doesn't affiliate with religion in any way, but may have their own spiritual relationship with a higher power of some sort. So we have to think about that and engage that sort of questioning as well. Let's see here. I definitely encourage you to try to recognize traditional healing approaches, recognize that fatalism is a value of destiny, or in some cases, divine intervention, right? When we talk about fatalism, we're talking about like that theory or concept of manifest destiny, like this is my destiny, or this is my, some people have described it as this is the cross that I bear or that I carry forward with me because of past sins, because of past behaviors, and that can be connected to individuals and or families, right? um, Thinking about that when we're really looking at it specific to our communities. I think this is definitely important, not only for the Latino communities, but also when we look at Indigenous and um, Native American, American Indian, Alaska Native communities. We see traditional gender roles sometimes being in conflict between what it is in the United States and what it may look like in their home country. And even when we talk about within the United States, American Indian or Indigenous or Indian populations will also come from more of a matriarch system. But it's very interesting because sometimes, even though the history of certain pueblos or Navajo reservations, etc., have a more matriarchal system where the mother of, Mother Earth is the bearer of life, etc., etc. We then see that they've taken on a lot of the patriarchy behaviors when it comes to governance in their governing of their pueblo or their community, their sovereign nation. So when we look at that, we have to think about that. How do they balance this machismo or patriarchy? Some people would kind of put that in there with Marianismo, and we always want to look at machismo can also be a very positive protective factor. But when it gets to be toxic, right, toxico or toxic masculinity or machismo, where it becomes a perpetuator of violence, someone that is overbearing, someone that is very controlling, those are things that we have to be very cautious of in terms of our addressing, but identifying those as concerns nonetheless and addressing those is very important. Marianismo, again, or kind of the matriarchal system, kind of takes the sense, like I mentioned, that females take on this virgin Mary-like demeanor or role of caretaker for the family, for their community, for their agency many times. And we have to think about that in terms of when we approach individual families, understanding, are they taking more of a matriarchal or patriarchal approach or machismo or marianismo approach to their family structure. I think that's important before you make the mistake of assuming that the man makes all the decisions in the home. You'd be very surprised in a lot of Latinx communities. The moms make a lot of those decisions, and if mama ain't happy, ain't nobody happy, right? So we have to think about that and really just do that breakdown. Echo mapping or doing kind of a breakdown genome map of your families really helps at that initial onset so that you know some of the historical trauma that may be included, and then kind of finishing that off with a cultural formulation interview is definitely something to think about. Family and spiritual or Marianismo, so again, maybe pillars, protective against some of these things that we've talked about, depressive symptoms, promote academic resilience, and that's based on some of the work of Rodriguez, Castillo, and Gondara. And then we look at some of the negative aspects of Marianismo, of women should know their place, or women should be in school, or they should go on to academic higher ed, those sort of things. And we know, and which is a really great thing, that Latinas, especially in the field of social work, are just blowing up and expanding. And I feel blessed to be a part of this profession that really embraces that and really sees that as a protective factor for our communities. Uh, we look at, again, continuing this kind of examination of the role or involvement of families. We definitely want to help them to have clear roles and expectations. A lot of times what we see also, so think about this in your families, you may have a young male that is, again, 18, 16, 17, 18, wherever within that framework, and single house, family, with the mother being the head of household. This young male may take on traits as kind of the patriarch and even start to step into a role where they're starting to become controlling of their mom, or in the role of kind of a more of a dad kind of figure. And we have to do our roles of clarity within our work of family therapy and really dissect that to a point where we allow the young person, the young male who's trying to be of a patriarch in a more father figure role, to just be a child, to be an adolescent. That's not their role. That's not what they have to do, right? So we have to really sometimes clarify familial roles and cultural expectations depending on the structure of the family. And I think that's really important, especially as we're seeing some of the immigration fallout of families that are broken up, that are being raised by extended families. Show respect, I think that's across the board, but in the Latino community, when you show respeto or respect, it definitely goes a long way. We see that a lot of Latino Hispanics show respect to professionals, and will definitely treat you as such. And sometimes they'll kind of step back and step out of the way from engaging within this, which we don't want them to do. We want them to be involved. So we sometimes have to clarify that for them, that even though they see us as professionals and that they don't want to get in the way of the work that we're doing with their loved one, we have to encourage that, right? We have to invite them in. We have to be proponents and supporters of family engagement, definitely to increase engagement as we see fit. So personalismo. And let me see, we're at 12:15. So I'm going to go ahead and suggest, let's just take a quick 5-minute break. Please don't get off of the computer or Zoom or anything like that. On the break, if you do have access to chat and you know how to send us a chat, what I'd love to see is just if all of you guys can let us know where you're logging in from across the country or across the world. Hopefully, some of you all are joining us. So just put in the chat, if you will, if you're joining us from whatever part of the country you're coming from, and then when we come back, we'll finish off the second part of this. We have I'd say about another hour or so left, and then I will allow for some questions here at the end as well that we can have our moderator help pass along to me. So let's take a quick 5-minute stretch break, get some water, get some nutrients, and I will see you guys back here in about 5 minutes. Alrighty, guys. I know. So I just got notified we're only on for an hour and a half today, so that's okay as well. For those of you that got up and stretched your legs a little bit, we'll go ahead and get back on camera, and I hope all of you can see me clear now. And we're on our get personal. So looking at the mental health protective factors. So one of the things that I want to kind of talk about a little bit here, and we have probably about, I don't know, 15 or 20 minutes left, and I think that's perfect amount of time to finish the slides, and then we'll have about 5 or 10 minutes, and I'll also give you guys my email address for those that want to follow up. I definitely hope that we can get some information to you all. It's a lot of information that I've pulled together around suicidal kind of just data, documents, information that I think would be very helpful for you all. So for those of you that are logged in with us today, we'll see how the center can send this out to you all to your email address or post it some way so where we can have or give you guys access to this as well. So with that said, I just want to make sure we give folks a little bit of time, since I did give a few minutes of a break here. Which usually in the hour and a half, we don't give a break, as you all know, but I think it's important with that said, that breaks are also a part of what reminds us of self-care, right? Throughout this process, I just want to reiterate how important self-care is, especially for those of you that are really working in the trenches with suicide, suicidal ideation, um, attempts, people that are taking their life by suicide, and that you really take the time to do your own kind of healing and your own work relative to your experiences, so that you can continue to do that great work, because we know that it's very hard work actually, and a lot of times we don't get a lot of recognition. And I will say this, that there's not a lot of people doing suicide prevention work, at least not any that are directly focused on that, right? And I think we definitely have to see a lot more of that. So with getting personal, this really means that we have to take some time to provide some opportunities to get to know the clients and the family, to demonstrate sympathy, our sympathy, kindness, our friendly. And when we develop this kind of personal experience with individuals, we know that the likelihood with and uh, compliance and outcomes, but also following through on the recommendations that you make to families and individuals, typically goes a long ways. And I think that's an important part of this as well, that we have to just think about moving forward. Collectivism is always a bigger kind of community vantage point, if you will, when we're looking at kind of the macro system. And a lot of Latino and Hispanic families definitely have this shared concept with other Latinos around their communities, and especially familial wise, that there's a sense of collectivism, that we can help each other create harmony and balance through this interdependence of each other. And we see that a lot within the Latino communities, and it's really, I think, a very strong protective factor that we need to continue to build upon, which sometimes goes against our view in the United States, right? Our view of kind of individualism and not so much a community or collective approach to things. So with that said, looking at some of the cultural variations of ways that you can ask these questions of your clients, right? Is, have you wanted to ever give your life away? I know, and the reason that we're offering just some cultural variations is that sometimes it's hard to breach that conversation with clients, but we always have to know that clients, just because you ask them about thoughts about suicide or hopelessness or sadness, does not mean that you're going to push them to take their life by suicide. It actually means the opposite. Many times you're actually helping them by giving them a lifeline, by actually reaching out to them, by really recognizing that they're going through something, right? So sometimes culturally we find it hard to bridge that conversation. So these are some ways that you can think about it. Now, if you're ever in doubt, I would not encourage you to tap around the issue or beat around the bush. I would directly get to the question, right? Are you feeling suicidal? Are you thinking of taking your life by suicide? Do you have a suicide plan? right? All of those direct questions. However, if you're just getting to know someone and that person hasn't come out that they're suicidal, but you're getting a sense that something's going on, right? These are some of those variations. Have you ever wanted to give your life away? Have you ever felt your loved ones would be better off without you? And then you have follow-up questions to those, right? Have you ever felt no one would care if you weren't around anymore? Have you ever felt you don't deserve to be alive? Have you felt so ashamed that you wanted to disappear? And then you can connect those to broader kind of categories or themes that you see around some of the cultural idioms of distress that we talked about today as well. Have you felt this world has rejected you? Asking questions also of individuals, do you feel safe in the school? And that's a huge question that I saw was very prominent in the trends that we saw in our research in New Mexico is one, kids felt hopeless, two, kids didn't feel safe at school, and three, kids had a means and access to different weapons and opportunities of lethality to take their own lives. So in our state, we've had to really look at all those things much more in depth as we move this forward as well. So with that, I'm gonna at least leave like the last 10 minutes or so. I see we're at 2:30 your time, started at 1 o'clock, so I want to make sure I give you guys a little bit of some time. I'm gonna go ahead and send my email address um, here in the chat, and I'll turn it back over to our moderator, either Angel or Cindy. If you want to see if there's any questions out there that I can answer, I would be more than willing to do that at this point.
Sure thing. Thank you, Rogi, for an excellent presentation as always. For all of our attendees, right now you have on screen the information for the evaluation. Like Rogi mentioned, this is what lets us continue to develop materials such as this one free of cost and provide technical assistance and trainings. So please take 1 minute to fill out the questionnaire. You can scan the code with your phone, or you can also access through the SurveyMonkey code that we have on screen. We'll be putting that on chat also for your convenience. If Rogi, I think you posted the wrong link, so I'm gonna be posting the right one. Please make sure that you access the one that finishes in DQG. If you're able to. We are here and we have chance for questions, so please feel free to input them in our question area so we can let them Dr. Romero know and he can help us out with those questions. Thank you, Cindy. We have posted the correct link in the chat, so please feel free to use that one and let us know what you think of this presentation. And feel free to share any questions with us. At the moment, Rogi, I'm seeing through here, we have congratulations and those people from California. We also have people from Watsonville. We thank you all for being here with us today and invite you to continue to support our network through the different webinars that we provide weekly and monthly.
Awesome. Yeah, and I included my email address, and I'll just say it out for folks that didn't get it there in the chat. It's Dr. J Rocky, so DRJROCKY @gmail.com. And with that email, you can ask me any other additional questions, maybe that you didn't get a chance to today. Also, I will definitely be able to be a contact in our region here in the United States and Southwest kind of region. If you need any technical assistance or additional training on suicide prevention, intervention, treatment that I can help facilitate on behalf of the Mental Health Technology and Transfer Center, I'd be more than willing to do that. And then, of course, Angel, I'll get with you all and see how we can send out. I have some additional resources for the audience that attended today that I can send in an email. It's quite a few documents, so we'll have to maybe be creative on how we share those. But it's good stuff for folks moving forward.
Yeah, definitely, Rocky. We have a question before I say the question, I would like to mention that for folks that are asking for certificates of attendees will be sent out by our colleagues from FIU after this webinar. So you'll be receiving that at the email of your registry. Please complete the evaluation so that you can receive that certificate after this webinar. You will be receiving that in your email. And the question that we received here, Rocky, reads, I would like to hear more about how to work with families who only want to work with their spiritual healer, even though their child is going downhill.
Yeah, I definitely think that's a slippery slope, so to speak, meaning that we have to be cautious because we don't want to totally say we think you should be doing your work with us and not with them, right? That's always a deal breaker in my experience. But see how you can integrate that, see how you can involve that person, or if they'd be willing to allow you to go and visit with him or that person when they meet with them. And the only reason that you're trying to do that is so that you can organize care, right? Is so that you can, because I think one big mistake that we make as a westernized kind of approach to treatment is that once we know someone's working with a healer or someone else, we tend not to reach out and try to connect with that person. And as long as you have a release of information for that individual, I definitely think it's appropriate to reach out and share with the individual, again, with the family's permission, and doing all the appropriate steps that way to really try to do a family session, even if it is via phone or technology nowadays. Zoom may be an option. A lot of our curanderas are continuing their work here in New Mexico, using technology as well. So it's been kind of interesting.
Great, thank you, Rocky. We still have 1 or 2 minutes on our clock, so if folks would like to share another question for Rocky to answer live, we'll be more than happy to read it out loud. Also, remember that Dr. Romero shared his email. Feel free to share any inquiries both to the emails on screen or directly to Dr. Romero so we can answer those accordingly.
All right.
We don't have any more questions. I would like once again to thank you everybody for attending today and remind you all that you have the information for our evaluation on screen and the correct link on your chat. So please let us know your thoughts on today's webinar. Dr. Romero, once again, it's always a pleasure to have you with us, share your knowledge. Thank you once again.
Thank you, Angel. We'll talk to you all soon. Take care. God bless.
Have a great day.